Hey everyone, welcome back to yet another podcast brought to you by Humans of Galgotias. At HOG, we believe every story matters. I'm Srishti Singh, and joining us today is Dr. Sumanta Ghosh. He is a respiratory physiotherapist and an instructor at PR Clinics and Academy. Hi, sir. How was your day today?
All well.
So, what is a typical day in your life look like?
So a typical day in my life is variable. So because I wear a lot of hats basically as a clinician. So when I is a clinical day, I'm mostly involved in two of our clinics. So this is one of the pulmonary rehabilitation clinic that we are sitting in today. Another clinic is in sector 132 Noida. So basically, as per the schedule of the patient, so various patients come to us at least 2 days a week or 3 days a week. So accordingly, I divide my clinical days, and then if it is a teaching day, so I'm involved in taking the classes, be it is a online class or an offline workshop. Offline workshops are sometimes in Delhi NCR region, sometimes they are out of station also. So I'm involved in that way. So a clinical day starts roughly around 10 o'clock in the morning, and we wrap up around maybe 8:30 in the evening. So it's a long day.
So, what is exactly pulmonary rehabilitation?
So pulmonary rehabilitation is basically the rehabilitation of patients with chronic respiratory diseases. So chronic respiratory diseases is the fourth largest killer in the world. So what happens is these patients are suffering from symptoms like breathlessness, which makes their basically life worse by the day. And what happens is they are not able to even do their activities of daily living. Even if the best pulmonologist, which is the doctor for the lungs, which are treating them with the best of medications, but they also need basically rehabilitation, which is called as pulmonary rehabilitation. So pulmonary rehabilitation aims at improving the symptoms of the patient by doing lung specific exercises specific to the patient's needs. It's a tailor-made program which is aimed at improving the patient's symptoms and patient's quality of life, to be short.
Okay, sir. How would you explain it to a patient hearing it for the first time?
So, hearing it for the first time, so what we explain to the patient is that you have the respiratory diseases, and we try to explain him that what is the cause. So if it is a COPD, we try to tell him that this is the cause of COPD. The is obstructed, the airways have become small, because of which there is respiratory muscle weakness that has come in, which is causing symptoms like breathlessness, etc. And the medications are given by the pulmonologist, but the additional help that will come from the pulmonary rehabilitation is that it will be tailor made to the patient's basically symptoms, which will involve breathing retraining, which will involve his respiratory muscle strengthening, which will involve his upper limb, lowering limb exercises, aerobic exercises, etc. And this will help the patient to improve his symptoms, improve his functional capacity, and thereby improving his quality of life.
What inspired you to choose respiratory physiotherapy as your area of specialization?
So some things are basically by choice, some things are also basically by the luck. So what happened was basically after my bachelor's, I worked for 1.5 year at a clinical physiotherapist. I had the opportunity of working for a few hospitals. Also worked as a sports physiotherapist for the army basketball team. But what happened that I had keen interest on the ICU patients also, and then I got masters. I got selected in Jamia University, and I had a choice of selecting between sports and cardiorespiratory, and I chose cardiorespiratory because I thought that I'd be able to help patients in dire needs. So that brought me to cardiorespiratory physiotherapy in my masters, and then during my masters, I developed a keen interest on the respiratory patients. So my master's thesis was also on the respiratory patients. So slowly, I involved in the respiratory, got additional training from the European Respiratory Society, etc. And then I landed up with a job as in charge for respiratory physiotherapy in Max Hospital, Saket, New Delhi. And then I think then the way ahead, last 15 years, I have been working as a respiratory physiotherapist.
So, how is pulmonary rehabilitation different from general physiotherapy?
So general physiotherapy, there is nothing called a general physiotherapy, right? So you are doing a case of musculoskeletal, which involves the muscles, bones, or a sports patient, which involves basically the sports injuries, or we're trying to improve the sports performance of the patient. And otherwise, basically, you are looking at neuro patients, pediatric patients, etc. So similarly, and pulmonary rehabilitation, we are looking at the rehabilitation of pulmonary patient. Here, the patient's need are different. The pathology is different, right? So here, according to the pathology, we treat the patient. So here, the main focus is maybe only on the respiratory muscle retraining, respiratory muscle strengthening, also looking at basically the aerobic, improving the aerobic capacity. So differs a little bit, but yes, the main basically basics of exercise therapy, main basics of physiology, pathology, and exercise driven basically treatment remains the same. But pulmonary rehabilitation also includes basically holistically, it includes the psychological assessment and the management of the patient, and also includes the nutritional assessment and nutritional management of the patient. So it is a holistic approach.
Are the tools and training significantly different too?
Yeah, the training. So for pulmonary rehabilitation, if you look at the national curriculum given by the Allied and Healthcare Council, and also the syllabuses that have previously come also, it includes pulmonary rehabilitation as a topic in the bachelor's level, but it remains to be seen how much it is taught practically, right? So in the and in masters also, if you choose cardiorespiratory, definitely it is a core part of your training. So it remains as a core part in the syllabus, but with the skill-based training that is required, so that is a lacuna as of now. I think with the skill-based curriculum that is implemented from the next year, I think it will be more there. But yes, there are additional trainings like we do. We have been doing basically a complete respiratory and pulmonary rehabilitation course. We have taught more than basically now 20,000 people on this. So we do specialized training so that the physiotherapists are equipped to start pulmonary rehabilitation.
Could you walk us through the typical components of a PR program?
So, if you see at a pulmonary rehabilitation program, the guidelines of the pulmonary rehabilitation that are given by international institutions like the ERS, European Respiratory Society, American Thoracic Society, AAC, BPR, ATS, etc. What they say is basically it should be a comprehensive, basically, the term should be at least 6 weeks duration, and the main components of pulmonary rehabilitation remains your breathing retraining, respiratory muscle strengthening, aerobic training, upper limb, lower limb training, balance training, nutritional assessment and management, psychological assessment and management, and then there are other components are also there like neuromuscular electrical stimulation, oxygen therapy, non-invasive ventilation plays a key role. So these are the main components, and then there are subsidiary or new upcoming basically treatment strategies that can be added to it.
Have the number of patients in this field increased since COVID?
Yeah, they. I think the number of patients have remained the same, but what happens is the awareness has improved. So people know now that what is pulmonary rehabilitation, and I think the awareness among medical professionals have also improved. The referrals have improved. So I think the patients are benefiting more for pulmonary rehabilitation now.
How long does a typical PR program last?
So as I told you, the pulmonary rehabilitation program is for at least 6 weeks duration. It can go up to 12 weeks or 18 weeks. The 6 weeks duration, at least 2 sessions per week should be supervised. The patient should come to the PR clinic for a supervised session, and then he should be doing the exercises twice daily at the home.
And how do you track the patient's progress?
So we track the patient's program with basically the baseline assessment measurements. So here you can see that we have various equipments like the PFT, respiratory muscle strength testing devices, and so we do a functional capacity measurement with a 6-minute walk test. We also take the subjective and objective measurements of breathlessness. Then we also look at basically the bioimpedance analysis to look at the basically nutritional status of the patient. We also look into basically the patient's status of life, quality of life with a chronic lung disease questionnaire. Right? These are basically the measurements that we take in the baseline. We take it in the third week and we take it at 6 weeks or 12 weeks whenever it is ending. And we look what is the patient progress. And then also every visit we take a basically track of the oxygen levels, the heart rate, the dyspnea levels, or the breathlessness level.
Are there any common myths or misconceptions that you frequently face?
So myths and basically misconceptions that we currently face is basically the patients think that I am already breathlessness or I already need oxygen. So if I do exercises, if I do pulmonary rehabilitation, it will worsen. So that is not the case because we are trained professionals who have done the masters in cardiorespiratory physiotherapy and dedicatedly working in this field. So when we do it, there are very insignificant chances of any basically symptoms flare up because of pulmonary rehabilitation. It's very safe.
एंड सर फर्स्ट ईयर में आके काफ़ी सारे बच्चे स्मोकिंग वगैरह स्टार्ट कर देते हैं, तो व्हाट वुड यू सजेस्ट फॉर देम टू क्विट स्मोकिंग?
So smoking is one of the most dangerous things that basically anyone can do at any age. So what happens is, as if you look at the lung, if you open the both the lungs as a carpet, so it will be the size of a Wimbledon tennis court. So to big is the surface area of the lung. But as you progress with the age, 40 plus, the surface area of the lung decreases. And if you smoke, the surface area of the lung will decrease at 5x speed. So that means you will lose the lung capacity, your airways will become small, and then ultimately you will have a disease called COPD, which will require pulmonary rehabilitation. So better not to smoke and not to worsen your life.
What tips would you want to give to the students who want to excel in this field?
So, if somebody is interested in pulmonary rehabilitation, I think they will definitely taste a lot of success in this field because there are a lot of patients. The awareness is improving. Only thing is basically the basics should be clear and they should be having good training on the field, good experience, hands-on experience on the patients, which will help them to progress further.
So what difference do you notice between teaching a class and dealing with a patient?
Teaching a class and dealing a patient, so two things are very different in many ways. So when you are basically teaching a class where you're imparting the knowledge of how to treat the patient further, and when you are basically treating a patient, you are basically imparting the disease knowledge and also the management knowledge to the patient to basically help him recover. So in that way, the two things differ, but ultimately this is a sharing of knowledge in both the cases.
How crucial is mental resilience in PR recovery?
So basically, the psychological part or the mental part of the pulmonary rehabilitation is a key component. Whenever a patient comes to us for the pulmonary rehabilitation, we start off with the baseline measurements of anxiety and depression scale. We look into basically the anxiety and depression level of this patient because most of this patient being chronically ill have some kind of basically anxiety or some kind of depression in due progress of time. And if there is such, so the importance remains very high. We try to counsel the patients. If the scores are very high, we also involve a psychologist to help the patient to recover in a faster way, and it also requires a lot of support from the patient's family.
So, a typical student's life involves no gym and no physical activity. Also, late night schedules for exams. What 2 to 3 habits would you want to suggest for them?
So I think physical activities remain a very important part, and also as the government is also progressing the Fit India movement. So always prevention is better than cure, right? So if you are physically fit, you will be able to cope up with the mental and the physical stresses in a better way, and you will be disease free. So the American College of Sports Medicine gives a guideline that every individual should be doing at least 15 to 20 minutes of aerobic exercises. It can be as simple as brisk walking at least for 15 to 20 minutes a day for 5 days a week. So I think if you're not doing any strength training, resistance training, at least a brisk walking at least 15 to 20 minutes a day is a must.
सर फोर्थ ईयर में आने के बाद एक स्टूडेंट का मेन फोकस किस चीज़ पे होना चाहिए इस फील्ड में?
सो फोर्थ ईयर में आने के बाद बेसिकली आप थ्योरी में बहुत कुछ पढ़ चुके होते हो। आपको अब वही थ्योरी जो आपने पढ़ा है वो क्लिनिकल कोरिलेशन में जब आप पेशेंट्स देखना शुरू करते हो उसमें आपको ध्यान ज़्यादा देना चाहिए। सो सी व्हाट हैपेंस इज यू हैव फर्स्ट ईयर यू हैव स्टडीड एनाटॉमी, you have studied physiology, pharmacology, then you have studied exercise therapy, biomechanics, and then you have studied the diseases in the third year, and the fourth year you are learning the physiotherapy management. So basically you have to correlate everything and see the patient as a whole and how your physiotherapy can help the patient to recover from that symptoms. That is very important. So fourth year, first thing is basically your clinical correlation and skill based. So you should be knowing basically some topics. You should be knowing should be know how. So suppose you are doing a surgery, it is just know how. You should know, because you'll never do a surgery. You should know how a surgery is done. But physiotherapy management, like basically rehabilitation of the patient, you should be able to do so how. That means you should be able to perform on actual patient.
So what do you think? Social media से awareness ज़्यादा फैल रही है या फिर misconceptions around this topic?
Social media say, so there are two types here. Social media say definitely there is spread of good knowledge sometimes, but there is also basically spread of misinformation at many times. So when you're following social media, I think it is very important to basically look at the source, look at the individual that is giving you the information, and look for biases.
So do you think laughter therapy, music, or even dance help in muscle recovery? I mean lung recovery.
Definitely. See, what happens is basically when you're looking into the basically the psychological status of the patient and you have to improve it, so it should be tailor made. So a person who may not like to laugh is basically a little bit on the introvert type. Maybe he'll not like the laughter therapy, maybe he'll like the music. So you have to basically tailor made according to his. But yes, this do help a lot. And I think dance is a very good form of rehabilitation. So there are traditional, basically dance practices, Indian classical dances, also basically Tai Chi, etc. from China help a lot from recovering from physical disease, because they need require a whole body movement and involve the muscles.
So did you always want to be a doctor since childhood?
So yes, I wanted to basically be in the healthcare field since childhood, and I think as destiny brought us, so very happy being a physiotherapist for whole of my life.
If you could go back to your college days, what one piece of advice would you give to yourself?
So if I could go back to my college days, one example that I will give to basically myself is that start looking at more number of patients and basically try to grab the basics, because you have to revise the basics a lot of the time.
So tell us more about the vision and mission behind Health Specifies PR Clinics and Academy.
So the vision and basically a mission behind health specific is basically when we look at, we have a vision that we spread the knowledge of pulmonary rehabilitation throughout the world, and specifically in India, wherein the respiratory diseases are becoming more and more, and it has come up to the third largest killer and the third largest reason of disability in India. So we have think that spreading our knowledge would help the patient to get more benefit. And as a clinical service provider, we always look into bringing positive changes to our patient's life. And that's what we have been having a 90% success rate in all the patients enrolled to our PR programs. And with our teaching program, we're trying to increase the healthcare force involved in the pulmonary rehabilitation to help more patients and reach to the even the two tier, three tier, and even the small towns of India.
Thank you so much, sir, for breathing wisdom and warmth into this conversation. Thank you so much.
So thank you, Humans of Galgotia, for inviting me for the podcast, and it is wonderful being with you guys. And hopefully, you'll inspire more physiotherapists, more general public in general, to be involved in pulmonary rehabilitation. Thank you.
Thank you so much.